Hello everyone, myself Dr. Jyotirmaya Segde. I am the lead consultant and head at Department of ENT, Aster Hospital, Whitefield. Today I will be talking to you about one of the most important topic called as obstructive sleep apnea. Because of today's lifestyle, either because of the pace at which the world is going or because of the obesity or other symptoms, we are facing a lot of symptoms of obstructive sleep apnea. So what are the most common symptoms of obstructive sleep apnea? Now, the first and most common thing which to remember is significant snoring. There will be very severe snoring. Then along with the snoring, you will have daytime sleepiness. You will feel groggy throughout the day. You won't have any stamina left. You feel very dull, weak and lot of stamina. And along with that, due to other complications, you may have something like associated diabetes, hypertension. There may be symptoms of stroke or any cardiac or heart related ailments. So how do you know whether it's a normal snoring or it's an abnormal snoring? Because 30% of the people also snore normally. It's called physiological snoring. For that, we do have to do something called a sleep test, or in medical terms we call it as PSG, that is polysomnography, which has 3 levels, level 1, 2, 3. And when we do this sleep study, we come to know whether you are really having an obstructive sleep apnea or not. And once we confirm that we have an obstructive sleep apnea, we have to even follow up with regard to the other parameters. Like you may be having other associated symptoms like obesity or hypothyroidism, hypertension, cardiac ailments, and local abnormalities in the ear, nose, throat, especially in the nose and the throat, like a deviated nasal septum. That is, the partition in the nose is deviated. Throat has become bulky, your tonsils are swollen, fat deposition is there in the neck. All these things contribute to something called as obstructive sleep apnea, which like mentioned earlier, is very common in today's lifestyle. So what do we do about it? Once we have done the investigation and found out that you have sleep apnea, there are 2 modalities of treatment. One is the lifestyle modification and medical line of management, wherein you will have to do some diet and the exercise and try to lose out, cut out some weight. Along with that, you will have to undergo this CPAP, that is called as continuous positive airway pressure. It's like a machine which has to be worn during night time, during sleep, which will prevent this obstructive symptoms. If you are not compatible with the CPAP machine or you are unable to use it, next thing what has to be done is the surgical line of management. There are various surgical managements. Basically, if the nose is involved, we do something called a septoturbinoplasty. If the throat is involved, we do something called as uvulopalatopharyngoplasty, or other advanced procedures which are there in the throat, which can be either with cold steel or laser or coblation, which all these facilities are available at Aster Hospital, Whitefield in the Department of ENT. In case of any further queries or you want to clear out whether you really have obstructive sleep apnea or is just snoring, please feel free to contact us and consult us at the Department of ENT at Aster Hospital, Whitefield. Thank you.